This is a special edition of Late Night Health. I'm Mark Allen. We're going to take a look at what do you do now with COVID-19 and you have some kind of orthopedic problem. You break a bone, you sprain a wrist, something. Our guest is Dr. Mossy Reynolds. He is a co-founder of an orthopedic surgeon at Silicon Valley Orthopaedics up in the Silicon Valley area. And Dr. Reynolds, welcome back to Late Night Health.
Oh, thank you, Mark. Thanks for having me.
And your partner is not available, Nick Gay.
Yes.
He had a family event, and that's okay.
Yeah. No, actually, his wife is expecting, and so I think that they have many appointments coming up, and over the course of the next, or today, and then of course over the course of the next couple of weeks.
Well, congratulate him for us, will you, please?
Yeah, absolutely.
Okay. So let's talk about something. Let's talk about COVID-19. Your offices are open, but they are not open for people with COVID-19 or somebody who has the flu.
Correct. Yeah. We're utilizing the CDC and the WHO and going off of the California Medical Association, all their recommendations with regards to seeing patients in the office. But taking all the precautions, the temperature and questionnaire before having the patients come through the office in hopes of not having any patients with COVID-19 come through the building.
Right. I saw a photo yesterday or the day before of somebody standing outside a Starbucks with a thermal thermometer, and they touch the forehead, and if you have a fever, they don't let you in.
Oh, wow. Yeah, no, I that's better than kind of our local Starbucks. They've decided to close all the local Starbucks in this area. And so.
Oh, did they really?
Yeah. The infrared thermometers have been popular. We're utilizing that in our office as well. And that's kind of the recommendation. Anyone with a temperature, obviously a cough, and anyone that has had recent exposure to a COVID-19 patient, we're trying to avoid those situations. So.
But at the same time, what's happening is that people are at home, and you get honeydews, both men and women. Fix that lamp. There's a light bulb out. Get those cobwebs, and they fall down. They go boom.
Yeah, absolutely. Yeah, I think now, kind of more than ever, I think a lot of the at-home projects are getting filled up. I had a patient that actually was working at Home Depot, and she said Home Depot is busier now than it's ever been because everyone's working on their home projects that they've been neglecting for so long because of their stay at home, the shelter in place that's been implemented.
And orthopedic surgeons don't tend to do home projects because your hands.
No, we're guilty. We're tinkerers, honestly. I mean, I think our lifestyles keep us busy enough to where we don't get in too much trouble at home, but given enough time, we'll find something to put together, whether it's something screwing in a bolt or hammering a nail. We'll find something.
Got it. You have a couple of kids running around in the background there.
Yeah.
And you have to put together toys.
Yeah, absolutely, all the time.
I was really bad at that when my kids were young.
It's you get judged if you don't put that together well. They say, Dad, if you can put together a leg, but you can't put together this car.
I hadn't thought about that. Yeah, I could talk it through, but doing it. And I always ended up with a couple of extra bolts or screws.
Yep.
When you're in surgery, you don't want an extra bolt or a screw.
No, you don't want any. You don't want less than's needed, and you don't want more than is needed.
Right.
And so, you're meticulous with what you put in for sure.
So let's take a look at what's happening. The hospitals, many of them are overloaded. People are coming in, they want to be tested for COVID-19. They may just have the flu. They have other issues. You're open for orthopedic emergencies. Is that correct?
Correct. Yeah. At Silicon Valley Orthopaedics, we have, many level 2 trauma centers and hospitals close by. We've got multiple emails through the health systems in our area asking if there was any way that we could help out both by being there in the ER to help out, or if there's anything we can do and what we had in our facility to help out. And granted, the majority of what we do is very orthopedic specific. We felt that we had access, or we had the ability to treat a lot of the patients that were going into the ER for non-COVID related pathology or injuries or anything like that. And so whether it's orthopedic, they fell and broke their wrist, they fell and twisted their ankle, or even non-orthopedic and possibly lacerations, cuts, different things like that. We have the facilities and we have the resources to kind of handle those things. And so what we've done is opened our facility up for those urgent type situations where we can keep people out of the ER and out of the hospital, for both for them and for the hospital itself, to decompress the hospital system.
Which would also decompress, if you will, as you said, urgent care as well?
Correct. Yeah, the urgent cares in the area are also very busy, and they're handling a lot of the patients. So that's the kind of the first place that honestly most patients are going, is to the urgent care for a temperature, to see if they can get tested, if they have a cough, et cetera. And a lot of times those urgent cares have kind of the bare minimum with regards to orthopedic specific injuries and also lacerations and different things like that. And so just another avenue for patients to kind of find care during this time.
Can I ask your take on COVID-19?
It's changing every day for sure. I were recently kind of reading a lot of the articles because there's been a big discrepancy in what we saw on the East Coast with New York and the curve over there versus what we're seeing in California. No doubt, we've taken the shelter in place a lot more serious here, but at the same time, there's also, I'm also questioning whether or not possibly we had it come through California a little earlier. Like they're possibly suggesting, and that a lot of us potentially may be immune to it, given our, given the population, especially in Silicon Valley, and the access to, the travelers that came from China really early on. So I wouldn't, again, I'm still reading and trying to learn about it, but I wouldn't doubt it if California, more than a lot of states, already has some level of immunity to it.
I spoke to a physician yesterday, a friend of mine. He's up in your area. I'll give you his name after we're off the air. And he said that if we were all tested even now, that there would be a greater percentage of people who have it and didn't realize they had it. Maybe they had a sore throat and they didn't have the cough, they didn't have the fever, but they were exposed to it. They had a mild case and they've now built up an immunity. Is that how it works? Absolutely.
Yeah. You develop antibodies to it. And that's how you test to kind of build up the immunity is once you get that novel coronavirus, you have once you're exposed to it, then your body develops these antibodies to it to build up the immunity. And there was that kind of the early flu that they talk a lot about in the Bay Area that came in at the end of December, middle of the end of December. They called it they said that the flu came early in the year. And so, I wouldn't doubt that there was some element of variation in the strain that potentially had come through California at some point. So.
And one of the things that I'm going through as I'm in lockdown, and I go out to the markets in Southern California, where I'm based, we're having trouble getting food delivered. We can get restaurant delivery, that's easy, but I don't want takeout every night,
Yeah, absolutely.
But the markets, even the major markets, have either stopped delivery or have curtailed pickup, which I thought was a great alternative.
Right.
We tried to order on Monday of this week, and we're recording on Friday. I had to wait 6 days and couldn't pick up until 7 o'clock tomorrow night.
Wow.
And so I mean, they're overstressed too, just like the hospitals.
Yeah, absolutely. And that's just, a perfect example of the system that's getting overstressed. And in the sad part about even that is what we're seeing in the Bay Area with different grocery delivery systems is they're getting stolen, or they're actually people are going to the grocery stores and taking someone else's groceries because they can't get it in time and things like that. And so it's I can imagine, I don't understand, or I don't kind of know the system as well, the grocery store, but you can tell that they are just struggling to figure out a good way to do it right now.
So you have kids and you have a wife. As your wife said, okay, be careful out there, just like they did on that police show a number of years ago. I mean, is she concerned about you going out and meeting the public?
She is, for sure. We're taking all the precautions when we do leave the house, the same as everyone else. She also knows that I feel just in medicine, we all tend, as you've seen with a lot of the first responders and those on the front lines, that there is this internal obligation that we've committed to as healthcare providers, and that there's never too much doubt in a healthcare provider. If you look and see how they're repurposing different physicians, physiatrists and orthopedists and dermatologists, they're all helping out the best they know how, or the best that they can in these circumstances, which is really cool to see. But obligation, I think, is probably not the right word, but just we look at it as it's our purpose, and that's what our training is. And so she understands that, and there's never been a doubt, from her end about me doing whatever I can to be safe in those circumstances.
Something about the Hippocratic Oath or
Something, yeah,
something like that.
Yeah.
Heal thyself and others as well.
Yes.
All right, let's talk about some of the things that you've seen in the last couple of weeks since you've been open as for emergency orthopedics. I mean, have you done surgeries? Have you had to pin bones?
Yeah, so we finished out when we first went to the shelter in place. We finished out some of the urgent cases that we had already committed to kind of completing, and there are certain cases that tend to have better outcomes the earlier you take care of them. So we finished those out, and then we opened the urgent care center. Most recently, we had a patient that unfortunately fell while out, getting some fresh air. He was on a bicycle, with his family, keeping his distance, and he fell and dislocated his shoulder. And called our office, knowing that we had set up an urgent care type situation in the evening time. And so my partner saw him and attempted a reduction to try to get his shoulder in place. But the problem with the shoulder is that a lot of times, if you don't have the proper relaxation, then the shoulder won't pop into place appropriately. And so we got him for that very next morning, was able to get him some sedation in our surgery center, and then was able to reduce him and get his shoulder back and lined up. And so, that's just one example of some of the urgent kind of situations that we can redirect over into the office setting now, as opposed to the emergency department, where before it was a no-brainer. You go to the emergency department, they can sedate you and put you to sleep. It's a little bit more of a process now, but we're still able to get it done.
And is that day surgery? Is that somebody?
Yep. Yeah. He we did it first thing in the morning. He was home an hour later. Just a little bit of sedation to relax him, and then we were able to pop it back into place, get him into a sling, and get him on his way.
Got it. What other kinds of surgeries have you done, or procedures have you done, so that people can be aware? Hey, if you're riding a bike and you haven't done it for a while, be careful.
Be careful. Yeah. So broken wrists. A patient that falls and breaks their wrists, the goal is to try to avoid surgery, but if we can't get it perfectly lined up, and if the fracture goes into the joint and it's more concerning, then there is a window which you want to get that lined up, and you want to get that fixed to prevent any further complications, including arthritis and different things like that. So falling down, breaking a wrist, the ankle fractures, rolling the ankle, that we can do kind of in the outpatient setting. Those are the ones that we tend to see the most when patients get outside and haven't been on their bike in a while and are trying to be active during this shelter in place.
And this is maybe a little bit outside your specific realm of orthopedics, but exercise is important at this time, isn't it?
Yeah, absolutely. I mean, I follow a lot of podcasts that talk about the mental side of this and the mental health aspect of what we're doing right now. And I think even beyond the physical side of things, just giving you peace of mind and putting yourself in an environment where you can not only have physical, the physical health, the physical side of it, but also the mental clarity and almost the meditative part of exercising. And so I think just as important as the physical side of it, the mental side of getting outside is important.
And walking. I started to go for a walk yesterday. It was cold for me, at least.
Yeah.
Here in Southern California, and it was raining.
Yeah.
And it seems to be a little bit clearer today.
Yeah.
Any tips on home workers? Maybe they're using a keyboard differently, mm-hmm. and that can affect your hands and wrist, carpal tunnel. Any tips like that?
Yeah, so if you have access to, I know it seems silly, but we're seeing a lot of back pain with all of this. So back and neck pain, with the home, people working at home now. And so what happens is when you're sitting on our couch and working, of course, your back kind of falls into that C position and you start to develop pain. I would say the number one thing is for that specifically, the back and the neck is to either, if you have access to, and a lot of people don't, but have access to some sort of stabilization or a Swiss ball, or try to be up at a desk and have the desk kind of at elbow or level, as opposed to kind of up. A lot of times when you're sitting and it's up here and your wrists have to kind of curl over, then you can get some more pressure on your wrist. So having something where you're actually focusing on your own core, not just resting and laying back onto the couch, where you're actually utilizing your own core and lumbar muscles, and then having everything kind of set at 90 degrees. And so that's the most common thing that we're seeing right now is patients are sitting on their couch, and kind of sitting back and working from their couch, and that's just taking all of the stress and putting it into the lower and back and cervical spine. So kind of activating your core, really whatever you can do to sit up and kind of activate your core. So,
Well, I know that you really don't want people to come in at this time, but
yeah.
you are open if they
Yeah.
if they need you up in the Silicon Valley. Can you tell us how people can reach you?
Absolutely. I think the number one thing is if there's a question, just give us a call and we'll direct you whether or not we think it's something that we can handle at our clinic, or if we feel like it's more appropriate for the hospital in the emergency setting. There's a couple different ways. You can go on our website, Silicon Valley, www.siliconvalleyortho.com, or our office. You can call us at 510-739-6520. So,
Gotcha.
you'll get
Doctor, thank you very much for spending some time with me here on Late Night Health. I really do appreciate it. Hold on a second. This is Late Night Health. I'm Mark Allen. Thanks for tuning in. And we will be back very soon with another report.